Today I am going to introduce the experiment number 1 to study the various instrument and apparatus used in the laboratories. Pharmacology is the science which deals with the study of drug. Experimental pharmacology is relatively the youngest branch of pharmacology. The main aim of the experimental pharmacology are to find out the therapeutic agent suitable for the human use and to study the toxicology of the drug, toxicity of the drug. To study the mechanism of action and site of action of the drug, and to study the action of existing drug. It is done in two phases, that is the preclinical study. Preclinical study means that is the experimental pharmacology where the drugs are tested on the animals and the animal tissues, the or isolated organs. And the second phase is clinical pharmacology where testing of drug is done on the volunteers. Healthy volunteers are the patients. Basic equipments used in pharmacology is student organ bath. The student organ bath, it is also known as tissue bath. Tissue bath is used to put the animal tissue for studying the action, mechanism of action, and determine the concentration of the drug is called student organ bath. This was designed by the Rudolf Magnus in 1904. The organ bath essentially consists of following: an outer jacket of the water bath. Uh, this is the outer jacket of the organ bath, which is made up of steel and glass purpose, and the inner organ bath are bath tissue made up of glass with the capacity of varying 10 to 50 ml. That is the organ tube. Sterile are present in the outer jacket, which are used to maintain maintain the equal temperature in the outer jacket. Thermostatically controlled heating rod is present to maintain the temperature of the outer jacket. Oxygen are delivery glass tube, which also serve a tissue holder, that is a aeration tube, that is known as aeration tube. And a glass coil, one end of which is connected to the lower end of the organ bath, and other to the container having physiological salt solution. And the glass coil is usually double the capacity of uh, inner organ bath to ensure the warming up of the solution before it enters to the organ bath. Uh, this student organ bath having two units of inner bath is called as a unit organ bath. This was first designed by the Gadam. And inner organ bath, it is of different sizes. A large bath capacity varies from 20 to 50 ml, mostly used in laboratories. A small bath made up of glass tubing capacity of 1 to 10 ml is used when small material is used for assay. Micro bath, it was designed by the Gadam. It is used only for special purpose and has capacity of 5 ml. Record and there is a recording lever is present, that is also known as lighting lever. A simple lever, it present in different form. Simple lever, it is the simplest type of lever made up of wood, stainless steel or aluminium. Uh, a celluloid writing tip is attached at the end of the long arm. Uh, in this side, we attach to the writing tip. The contraction are recorded as curved line. Frontal writing lever. This lever is designed in such a way that writing point rotates freely about its axis recording tip. The contraction are recorded straight lines. Uh, Starling heart lever. Starling heart lever. This lever is used to record the contraction of heart and Broad's lever. It is a general utility lever. Next one is the Strington rotating drum. Strington rotating drum means the instrument consists of an electrically driven gearbox which has a clutch and control which determine the speed of rotation. The drum rotates in clockwise direction. Therefore, all kymograph records should be read from the left to right. While using Singleton rotating drum and kymograph ensure that uh, friction between writing and drum should be as low as possible. The friction must remain constant through the experiment. Writing tip must remain constant through the experiment. Writing tip must be rigid. Aluminium and magnesium tip are best suited for the purpose. For this purpose, paper used to cover drum should have a smooth writing surface to avoid and reduce the friction between the tip and the writing. Second one is the rotor rod apparatus. It is used to evaluate the muscle relaxant activity of anti-anxiety drugs like diazepam that interferes with the motor coordination. One of the important pharmacological action of an anti-anxiety agent of diazepam class of drug is muscle relaxing property. The skeletal muscle relaxation together with having a calming effect. These agent reduces anxiety and tension. The loss of muscle grip is an indication of muscle relaxation. This effect is easily studied in the animal using inclined plane rotating rods. The difference in fall of time from rotating between the control and diaphragm treated animal is taken as an index of the muscle relaxation. Um, when we take the uh, two types of groups. Uh, that one is the control group and the drug group, standard test group. Uh, when we took the control group, we did not administer any type of drug, and rat or mice put on this rotating rod. Uh, uh, we noted that the gripping strength of the of mice or rat is very good. Uh, uh, and when we give them to give them diazepam, the gripping strength become very loose, and and the fall time is less than in the control group. That time was noted on the record of the record book.